Okay, patient safety and quality. What does the R in RACE stand for? Run, rescue, respond, move. Rescue. Rescue. Aid. What the fuck does it mean? I don't know what it means. Rescue. Evacuate's the last one. I don't remember what the third one or the other ones mean. Which restraint practice is correct? Tie the restraints to the side rail for quick release. Use the least restrictive device possible. Apply restraints without ongoing assessment. Leave the patient in the restraints indefinitely. Obviously, you're going to go for the least restrictive possible. There's crap all over my screen. Which actions reduce the risk of fall? Select all applied. Keeping the bed in the lowest position possible. True or false? True. Ensuring that the call light is within reach. True. Using scatter rugs near the bed. That's a tripping hazard. False. Applying non-skid footwear. True. Hourly rounding. True. Make sure that patient doesn't need to pee. Which is the safest restraint alternative for a confused patient at the risk of wandering? 4-point restraints, assigned sitter, tying the patient's hands loosely to the bed, and or sedating. Clearly a sitter. You want to go least restrictive. Might be more expensive, but you know, they're going to be there anyways. The best way to evaluate fall... Oh. The best way to evaluate if fall precaution teaching was effective is patient states, I won't fall again. Patient demonstrates the use of the call light before ambulating. Family says they will remind the patient. Nurse notes bed alarm is on. Patient demonstrates use of call light before ambulating. That's going to be your best. A patient becomes violent and threatens the staff. The nurse's priority action is attempt to reason with the patient alone, ensure personal safety and call for assistance, apply restraints immediately without an order, leave the patient unattended. Okay, well, we can cut this one out and cut this one out. Attempt to reason with the patient alone or ensure personal safety and call for assistance. Clearly, you're going to do that. Which is the action a nurse should take if the first action a nurse should take if the patient begins to fall while ambulating? Call for help, try to hold the patient upright, ease the patient to the floor while protecting their head, leave to get another nurse. First action. You can simultaneously call for help and ease the patient to the floor while protecting your head, but this is a fucking NCLEX question, so they don't ask about simultaneously. C is the answer. Ease the patient to the floor while protecting their head, then call for help. I think the idea is like focus on the patient, make sure that their fall is protected, and then you can, do what you need to do. A nurse finds a small fire in a patient's room. The first action is activate the fire alarms, close all the doors and the windows, rescue the patient from immediate danger, extinguish the fire. Yes, rescue the patient from immediate danger. Race. Which precaution is appropriate for a patient with C. diff? Standard, contact. Oh, wait. Why does it say that? Which precaution is appropriate for a patient with C. diff? The answer is contact with soap and water hand washing, but that's the... You wash your hands because it's spores. Which link of the chain infection is broken when a nurse performs hand hygiene? Infectious agent, reservoir, portal of exit, mode of transmission. The bacteria, where the bacteria lives in your lungs, how it gets out of your body through sneezing, or the contact, you cough and you sneeze and it gets on somebody's hand and now it's a contact transmission. Washing hands, clearly it's mode of transmission. Which is the right, what does PASS stand for? Pull, aim, squeeze, sweep. Push, alert, shout, stop. Pull, act, stand, secure. Point, aim, sweep, spray. Pull the little tag thing out, aim it, squeeze, and sweep at the bottom of the fire. What are examples of standard precautions? Select all that apply. Hand hygiene, true or false? True. Gloves for bodily contact? True. Wearing a mask for all patients? False. Safe injection practices? True. I mean, yeah, you always want to do that, but it's standard. Disposing of sharps in puncture-proof containers? True. I think the last two are kind of weird, but yeah, they're standard precautions. It's just, this is more in the idea of like MRSA or something. Not MRSA, like a broken foot. Which mode of transmission requires a private negative pressure room? Droplet airborne contact or standard? Yep, airborne. TB. Okay, follow-up question. What needs a positive pressure room? Yes, neutropenic. Somebody with a compromised immune system. How the hell did my cat get in here? Because the door's closed. Which type of precaution is required with a patient with tuberculosis? Okay, those are two of the same questions. Yes, airborne. We just did that in the last question. A nurse observes another nurse not washing their hands between patient. The appropriate action is to ignore since the unit is busy, report the behavior to the supervisor, ask the nurse to stop and remind them of policy, document it in the patient chart. I mean, yeah. We don't need to report the behavior to the supervisor. We're not assholes here. Hey, you forgot to get hand sanitizer when you walked in that patient's room. Just, we're all fucking tired here. Oh my god, he's pissing me off. Goopy, get down. Get down. Okay. Which action best reduces infection risk when inserting a urinary catheter? Maintaining sterile technique. I'm just getting tired. I've read these questions 1,000 times. Which link in the chain of infection is interrupted by wearing gloves? Okay. Once again, you're wearing gloves. You cough out a bacteria. Bacteria is on the table. Somebody touches the bacteria with their hands. But guess what? They had gloves on. So that is the mode of transmission. How do you put BPP? PPE on? Gown, mask, goggles, gloves. Mask, gown, Okay, I'll give you a hint. Gloves are last. Gown, mask, goggles, gloves. Goggles, gown, mask, gloves. It's A. Gown, mask, goggles, gloves. GM, GG. There's gotta be some stupid thing you can think of to remember that. My cat is pissing me off. Get down. The portal of exit in the chain. Dude, get down. I keep putting him off my bed and then he immediately jumps back on. And then I have to throw him off again. I just threw him down. Now he's looking at me up from the ground. The portal of exit. Get off the bed. And he's laying down now because he knows he's slowly inching his way while laying down. He's inching his way over to me. The portal of exit in the chain of infection for tuberculosis is the respiratory tract, the skin, the GI tract, the urinary tract. Well, where is tuberculosis in your body? It's a respiratory disease. So, yes, it's in your respiratory tract. That's a weird question. Which are principles of surgical asepsis? Surgical asepsis is sterile. Sterile object remains. Just select all apply. A sterile object that remains sterile only when touched by another. A sterile object remains sterile only when touched by another sterile object. True or false? True. You can't touch a sterile object with your hands because your hands are not sterile. Sterile objects can be placed below waist level if visible. False. It has to be above the waist. Sterile fields become contaminated when wet. That is true. Maybe because it soaks it up from the bottom, I'm not really sure. The edges of a sterile field are consistent with are considered Hold on. The edge of the sterile fields are considered contaminated. Yes, you have a 1-inch margin. Prolonged exposure to air contaminates the sterile field. That's also true. We didn't learn that, but that is true. So your answers are A, B, C, D, E? Oh, no, not B, not B, not B. All but B. Sterile objects can be placed below the waist level if visible. They cannot be. Which nursing action breaks medical asepsis principles? Wiping front to back for perinatal care, placing a contaminated dressing in a biohazard bag, recapping a used needle before disposal, covering mouth when sneezing. You can't recap your own needles. You're going to get AIDS. Which conditions require contact precaution? MRSA. Oh, sucked all apply. MRSA, true or false? Contact, true. Tuberculosis, true or false? False. What does it need? Airborne, yes. C. diff, true or false? True. Varicella, chickenpox. Yes, false. I don't know what it means. VRE. It's true. I don't know what it is though. A protective equipment. Oh my god. A protective. I'm so close to being done. I'm so tired. Protective environment isolation is used for patients with TB, patients post-transplant with low immunity, patients with MRSA, patients with influenza. Protective environment. Positive pressure. You want the air that's unhealthy, you want it to be replaced with new air. And you don't want to, they're low immunity. Protective environment, low immunity. Those two things it should raise a flag in your head. Which hand hygiene method is recommended when caring for a patient with C. diff? Alcohol-based hand sanitizer, soap and water, hand washing, gloves only. C. diff, it's contact precaution. My cat, I guess, has broken the seal in between, like what holds my carpet down and then what goes to my wood floors, and now it's coming up and he's scratching it. Get out of my room. Get out. Goodbye. Okay, we're so close to being done. C. diff turns into a spore. It's in the air. Not in the air, but it's spores, so you have to wash your hands with soap and water. Which action breaks surgical asepsis during sterile gloving? This one threw me for a freaking loop. Picking up the first glove by the inside cuff. The first glove, so you're scooping no, you're not scooping, you're grabbing the inside of the cuff, the thing that's going to touch your skin. Touching the outside of the first glove with a bare hand, so touching the part that is going the outside, the part that's wrapped around your hand, you're touching the outside of that. Sliding gloved hand under the cuff of the second glove, so doing that scoop motion. Keeping hands above the waist once gloved. It's this one. My brain does not work well with motions written on paper. Which type of precaution is required for flu? Droplet. What's the correct order of taking off? I'll give you a hint. It ends with mask. Gloves, goggles, gown, mask. Gloves, gown. I read that wrong. Goggles, glove, gown, gloves, mask. It's gloves. Gloves are first. You want to start with the most things that's dirty to the least dirty. What situation requires droplet precaution? Measles, chickenpox, pertussis, or tuberculosis. I don't know what this is, but it's pertussis. Which PPE is required for airborne precaution? Airborne, same thing as TB. N95. A nurse is preparing a sterile field. What action contaminates it? Holding sterile objects below the waist, reaching over the sterile field, opening sterile packages away from the body first, adding sterile solution without splashing. Yes, it is reaching over the sterile field.